Hello and welcome to this presentation on Finding the Evidence Part 1, Formulating Clinical Questions. My name is Derek Yates and I'm the Evidence-Based Practice Tutor for Birmingham Women's and Children's NHS Foundation Trust. In this session we're going to look at three objectives around the process of formulating clinical questions. Firstly, we'll look at where questions fit into the evidence-based medicine process. We'll look at the difference between the two main types of clinical question. And finally, we'll look at how to formulate an answerable clinical question. So, where does the question itself fit into the evidence-based medicine process? Well, it's actually part one. The question is the base upon which the process sits, and questions should be designed and refined to provide us with a basis on which to provide evidence for patient care, fill a gap in our knowledge, or as a starting point for a research project. The next part of the process is the search for literature that may provide answers to our question. Next, we critically appraise the literature to see how methodologically robust the studies our search has identified actually are. And one of the reasons that we do this is to give us the confidence that the research findings themselves are useful. We then implement the findings from the literature into our practice, providing, of course, that they're right for our patients. And finally, we evaluate the practice to see if we've got the desired patient outcomes from the evidence we've used. We sometimes see this process referred to as the 5 A's. So we ask the clinical question, we acquire the evidence by searching the literature, we appraise the identified evidence for quality and appropriateness, we apply the evidence into practice, and we assess and evaluate the whole process. Now, you may find this diagram and the 5 A's a little easier to remember. But what's nice about this diagram is that it shows the patient at the centre of the whole process. Always remember to keep your patient's needs, values and preferences at the centre of evidence-based practice. So, why is the question and getting the question right so important? Well, defining our question and making it answerable helps us to focus on the evidence that's relevant to our patient and their needs. A well-written question will suggest a high-yield search strategy, and I'd go as far as to say that a well-designed question can help virtually write the search strategy for us. And finally, a question can suggest useful forms that answers might take. So, for example, if we define our question as a question about treatments, then we can use the search to identify therapy reviews, randomised controlled trials, which are the best types of evidence to answer therapy questions, methodologically speaking. So, what are the main types of clinical question? Well, there are two: background questions and foreground questions. Background questions themselves are broader and usually consist of two parts. The question root, a who, a what, a where, a why, for example, and then an aspect about medicine, the disease, the medical disorder, the test or the treatment that we're interested in. So, some example questions might be, what is gastroschisis? Do vaccines cause autism? Foreground questions, on the other hand, ask for more specific knowledge that are intended to inform our clinical decision making. They usually consist of 3 or 4 of the following elements. An element about the population, the patient or the problem that we're faced with, or indeed any combination of the 3. An element about the intervention or exposure we're interested in. In terms of questions about diagnosis, this part of the question would relate to diagnostic tests. An element about any comparison that we're interested in, and an element about any outcomes of interest. And you'll recognise that what we're building here is a PICO question. So, an example foreground question could be, is oral sucrose effective in reducing procedural pain from events such as heel lance or intramuscular injection in premature infants? And we can see that the question contains a population, premature infants, an intervention, oral sucrose, and an outcome, reducing procedural pain. So, when it comes to formulating a clinical question, we need to look at the problem, the scenario, or the knowledge need that we're faced with. We then rephrase this using the PICO elements into an answerable clinical question. Remember to keep it concise, keep it clinical, and use appropriate language, and always avoid colloquialism. And by this, what I mean is that we keep it free of local terminology. And the best examples I can think of here are usually drug names or names for procedures that you might use on the ward or by the team locally, but they're not really used any wider than that. Always remember to consider your patient's needs, values, and preferences. And only ask one question at a time. By this I mean, for example, you might be interested in dozens of different types of outcome, but consider writing a question that looks at one type of outcome and then write separate questions for the other types of outcomes. Or if you're considering any outcomes at all, you might choose to not specify any. Adding too many terms into a question means that we can end up with an unwieldy question that's difficult to search on. And the search may identify so many answers that we end up having to screen thousands upon thousands of abstracts, many of which could be irrelevant. On the other hand, an overly complicated search may identify nothing at all when there are answers of relevance out there. So, that's the end of our presentation on questions. Now we have an exercise for you, and what we'd like you to do is complete the worksheet that we've provided. We want you to think of a recent patient encounter, and if you can't think of one, feel free to make one up. Now use the PICO formula to rephrase this into an answerable clinical question. As I say, please use the worksheet provided, retain a copy of the question for yourself, and send one in to us. We'll be asking you to use this question when you come to the searching exercise during the training session later on. Thank you for watching, and good luck.